In the dark days of lockdown, AstraZeneca's COVID jab was quite literally the shot in the arm we needed. Billions of doses later, its time is up. The vaccine withdrawn by the company because of falling demand. Augusta Turiaco's family won't miss it. She died 19 days after having the jab in Italy, and they're taking legal action against the pharmaceutical giant.
My family and I are not against vaccinations. We want to clarify this. When my sister died, we invited people to get vaccinated, as long as it was a safe vaccine. And for us, AstraZeneca, unfortunately, was not a safe vaccine.
Brian Pinker was the first to have the Vaxzevria vaccine in January 2021. Boris Johnson also had the jab, heaping praise on the Oxford University scientists who developed it. In its first year, 3 billion doses were distributed, with more than 6 million lives saved. But the United States never licensed the vaccine, and as clotting concerns grew, it was suspended or withdrawn, first in Denmark and then several other European countries, while in the UK it was restricted, first only to be used in people over 30, then those over 40.
And its legacy should be definitely a positive one rather than a negative one. So across the height of the pandemic, the AstraZeneca vaccine was indeed the vaccine for the world. It was a vaccine that was much cheaper to manufacture. It could be stored at fridge-like temperatures rather than the ultra-cold chain, the ultra-frozen temperatures that were needed by Pfizer and Moderna. So it was much easier to transport to, for example, rural settings in Africa and be deployed there.
AstraZeneca has always insisted the vaccine's benefits outweigh the risks. A spokesperson added, "We are incredibly proud of the role Vaxzevria played in ending the global pandemic. Multiple variant COVID-19 vaccines have since been developed. This has led to a decline in demand for Vaxzevria, which is no longer being manufactured or supplied." But the biotech that underpins the vaccine may survive, perhaps tweaked to avoid blood clots, ready for the next race against a virus. Thomas Moore, Sky News.